Rebecca Nelson. I'm going to be taking care of you today.
Hi,
I'm just washing my hands here. What's your name?
Ashley Holman,
And what's your date of birth?
10/31/92.
Okay, it looks like it matches your wristband, so that's good. So my understanding is that you're here for just an overall examination of your heart and kind of vascular system.
Mm-hmm.
Is there any specific concerns or things that have been bothering you?
No, just a checkup.
Okay. I understand you're pregnant as well. Has that caused any issues?
No, not really.
Okay. So I'm just gonna start the assessment then. Let me know if you're feeling uncomfortable, if anything's painful, if you need me to stop or take a break, okay?
Okay.
I'm gonna start by just looking at your carotids up here. I'm just gonna start and I'm gonna palpate your pulse. From medially all the way out to your muscle here on your neck. Alternating sides. Those feel nice and strong. Next, I'm going to listen to each of your carotids. Those are the arteries in your neck. All right, I'm going to work my way over here. Alright, everything sounds okay there. Was that uncomfortable for you at all? Did you get lightheaded at all?
No, that's fine.
No? Okay. Next I'm just going to move on to your heart. First I'm just going to look and inspect all of your the cardiac landmarks. You have your aortic area, your pulmonic area, your tricuspid, your Erb's point, your tricuspid, and then your mitral, which is your, normally we can see a pulsation there. It's called your apical pulse. Looking, I don't see any pulsation in any of your spots, which is totally normal. Only 50% of the population can you see a pulsation at your apical pulse down here. Now I'm going to palpate, okay? Is that all right?
Yep, that's fine.
All right. Just going to be feeling for a pulsation. Good. Aortic, pulmonic, Erb's point, tricuspid, and then your apical. It's kind of here in your fifth intercostal. Okay, moving on, I'm gonna assess your jugular venous pressure. This correlates to your CVP pressure, which gives us a really good idea of how your heart's working. So it's a little different. I'm gonna just lay you flat here so I can take a look at your jugular veins. The external one is easier to see, but I'm gonna be looking for the pulsation of your internal and then comparing it to your angle of Louis. I'm just gonna lay you down here first, just so I can make a good look. All right, just turn your neck that way. All right, I see your external jugular and your internal. I'm gonna put you up to 45 degrees just so I can get a better look at where that the oscillation of that vein. Let me double check to make sure we're at 45, a little higher. There we go. Can you turn your neck that way? Okay. Okay. I'm just going to put this note card at the top of your, the highest pulsation or oscillation that I see, and then compare that with that angle of Louis at in your sternum. All right, that looks like about 2 centimeters, which is really good. That just tells me that your CVP is about 7, and we're looking for less than 8, so that's really good. Any questions about that? I know that's kind of weird. Okay. All right. Next, I'm going to move on to your legs and feet. Do you mind if I take your socks off?
That's fine.
Yep. Painted toenails. Nice. All right. So I'm just going to feel your pulse here on your radial. Just looking for a nice strong pulse, which I feel. Then your brachial. Awesome. I'm going to look at your Your hands feel warm, you have good, nice color. I don't notice any significant edema on that extremity. Gonna move on to this one. Gotta watch what I can squeeze through here. Pulse feels nice and strong. Brachial as well. Cap refill is less than 2. Hands feel warm, no edema. You have a appropriate skin tone. Just gonna look at your cap refill on this side again. Less than 2, perfect. And then I'm gonna do the same stuff down here. Have you ever had any issues with any swelling?
Mm-mm.
I don't note any swelling or pitting edema, which is good. Can't really tell your cap refill because your toenails are painted, but if I squeeze there, I can tell a little, it's less than 2. Feel warm, good color. I'm gonna feel your dorsal peel pulse here. Nice and strong, and then on this side. Awesome, and then I'm gonna feel your PT pulse here, posterior tibial. And on this side. Both feel great. Nails look good, pink, moist, no clubbing, even. Awesome. I'm gonna feel your femoral there, is that okay?
Yep.
All right, make me a little uncomfortable here. Awesome. Alrighty. I say awesome a lot, don't I?
That's alright.
Okay, is there anything else before I listen that you would like me to take a look at?
No.
Okay. Alright. So next I'm just going to take a listen. I'm going to count your pulse at your apical or your mitral spot, just to make sure you're in between 60 and 100 beats per minute. And I'm just going to be listening for your S1 and your S2, which are the 2 sounds that your heart makes, okay?
Okay.
Alrighty. Sorry if this is a little cold. First I'll start at your aortic. Move over to your pulmonic. Down to Erb's point. That tricuspid spot. Listening for the S1 and S2. I don't hear any abnormal murmurs in any of these spots or any S3 or S4 sounds, which is good. And then here, I'm just going to listen and count your pulse here. Awesome, 74. Okie dokie. So I think that's all we have today. Do you have any questions
No,
or concerns?
not at all.
Everything looked great. Like I said, your heart sounded great. Your cap refill and you have no edema and all your extremities checked out good. Your jugular venous pressure was normal and your carotids feel great. Good luck with your baby.
Thank you.
All right, I'm just gonna wash my hands here. Hand sanitize my hands and I'll be out. Somebody will be in to help you. Thank you.